Miss T is a 25-year-old single white female with long history of borderline personality disorder and bipolar disorder. She is accompanied today by her mother. Miss T lives at home with her parents. She has a long history of inpatient acute psychiatric hospitalization for self-injurious behaviors and suicidal attempts beginning at age 15 years old. She was last hospitalized about 1 year ago, during which she spent 4 months in a locked psychiatric facility until she was stabilized and discharged home to her parents. Miss T did not graduate from high school. She dropped out at 10th grade due to multiple school fights, tardiness to school, and multiple psychiatric hospitalizations. Patient has been tried on different psychoactive medications. She's currently stabilized on Abilify 20 mg POQ daily, Depakote 500 mg PQ daily, and Seroquel 50 mg POQHS at night. She reports she has been having issues in her relationship with her boyfriend. She presents today for a therapy sections. No known allergy and drug allergies. She denied alcohol and no illicit substance use. No issues with sleep. And appetite has been good, as she tells me. She denied auditory visual hallucinations, suicidal ideations, homicidal ideations, and no intent and no plans. She denied any perceptual disturbances and no recent manic episode noted. Family history is significant for major depressive disorder and bipolar disorder. Her mother has bipolar disorder, started at age diagnosed at age 22 years old. Psychotherapy is considered to be the primary treatment for bipolar personality disorder. This is so because the stably unstable nature of borderline personality disorder. The primacy of the psychotherapy is also because of the limited efficacy of pharmacotherapy for borderline personality disorder. Currently, 4 comprehensive forms of psychotherapy have been found to be effective in treating those with borderline personality disorder, according to Linehan, 1993. These psychotherapies that have been found to be effective in treating borderline personality disorder are dialectical behavior therapies, mentalization-based therapy, schema-focused therapy. For the purpose of this presentation, I will be discussing more on the DBT, which is the dialectical behavior therapy, mentalization-based therapy, the MBT, and also the schema-focused therapy, which is the SFT. Dialectical behavior therapy is a comprehensive cognitive behavior therapy for complex, difficult to treat mental disorders. It was created by Marshall Linehan. It helps patients deal with emotional reactions, designed for patients who self-harms. DBT uses a skills-based approach to teach patients how to manage emotions and to tolerate distress and improve relationships. The mentalization-based therapy, it helps the patient in the ability to think about internal events such as their thoughts, the feelings, desires, and needs in oneself. Patients with borderline personality disorder are often unable to consistently mentalize, and this is according to Bateman and Fonagy, 2010. Schema-focused therapy. This is a form of therapy that brings together elements of cognitive, behavioral, psychodynamic, and experiential therapies. It focuses on a patient's pervasive thinking, feeling, and behavior. So I will be having a therapy session with my patient, Miss T. And before I go ahead, Miss T, I just want to be able to make sure that you consent to proceed with this video recording.
Yes, doctor.
Okay, good. We will be using the approach of the DBT, which is the dialectical behavior therapy. Have you heard anything about that, or do you know about it?
Not really.
Not really?
Yeah.
Oh, okay. So, how are you doing today?
I'm doing okay, doctor.
Good.
Not hearing voices anymore, but my relationship with my boyfriend is so chaotic right now, and I've been feeling like calling myself again.
Oh, okay. We will go over some skills today that will help you to deal with the negative thoughts and emotions. I understand relationships can be difficult sometimes,
Right.
okay? One of the DBT skills I will be talking about today is the tip skills, which is like whenever you're feeling enraged or angry or distressed, you could put some arms in your palms. When you put these arms in your palms, anytime you're having a feeling to cut yourself or distress, it will activate the dive reflex, which redirects blood to your vital organs, taking the blood away from your extremities. And it will also help in slowing your heart, which means it will help you to calm down, okay?
Okay, I think I've heard about it before. One of my friends I met when I was locked up at a facility told me about the ice therapy.
Oh, okay, good. Another one is the journaling. When you get a book or a journal, you just write about the pros and cons, okay? When you write about the pros and cons, it will help you to visualize, what you're trying to do. So it will help you to, know exactly. This will help to de-escalate your emotions as well, okay?
Yeah. The radical acceptance will be difficult for me to do. How can I accept what I can't control?
Okay. Also, the willing hands and half smile. Sometimes you open up your arms and you smile. It's just going to make you be in a form of acceptance. That way it changes your demeanor as well. Okay.
Okay, doctor.
Sure. And another one is the radical acceptance. Accepting that situations are what they are and it cannot be changed.
Right.
Okay?
Right. Oh, the radical acceptance will be difficult for me. I don't know how I can accept what I can't control.
Yes, you're very right. This is one of the difficult skills to imbibe, but you have to come to terms that you cannot fix everything.
Right.
Okay?
Right.
And also the stop skills, which helps to calm down as well, which is to stop. You take a step back, you observe, then you proceed mindfully. When in a state of distress, go through the steps. It will help to take a second to reassess your surroundings instead of going straight to the maladaptive behaviors. Okay?
Okay, doctor.
All right. So I will see you in next 2 weeks for our next section on mentalization-based therapy. Okay?
Okay, doctor. See you next week then.
Sure. You're more than welcome. Hi, Miss T. How are you doing today?
Oh, I'm hanging in there, doctor.
Oh, good, good. It's good to see you.
Good to see you too.
How have you been since our meeting 2 weeks ago?
I've been okay, just kind of stressed and pissed off, doctor.
Oh, you mentioned you pissed off. Can you tell me a little more about that and what happened?
Yeah, my stupid boyfriend decided to go out with his friends on our second year anniversary. I was so pissed and enraged, almost cut my wrist.
Oh, okay. I know that must have made you really mad. And how did you feel about it?
Oh boy, I was very mad, but I'm glad I was able to focus on what you taught me during our DBT skills, right?
DBT skills, yes.
Yeah, I held a block of ice on my palm, which kind of helped to redirect my anger and stop me from cutting myself. My boyfriend eventually apologized though, which was nice.
Oh, great. Yeah. I'm glad you implemented the ICE skills in DBT therapy that we discussed about during our first session. So how do you feel this very moment?
I feel better now talking about it and kind of like taking time to internalize it. I feel better.
Oh, great, great, yeah. Great. Well, I'm glad you didn't cut yourself, and I'm glad you did the right thing to internalize, these things, and you think about it.
Right.
So, great. I will see you in next 2 weeks for our session on schema-focused therapy.
Oh,
and
okay.
It's a great thing that you were not able to act so, promptly and quick.
Right.
To the maladaptive thought process and the negative thoughts. Mm-hmm. Okay, sometimes there's a saying that says time is the best erosive agent that erodes all wounds. Okay. So, and this is according to, in the words of the great philosopher Socrates. Okay? So we need time in life. You sit back, you take a step back, you sit back, you think, you reassess the situations before you act.
Right.
Okay?
I'll do that.
Good. Well, I will see you back again in 2 weeks for our section on schema-focused therapy. Okay?
Okay, doctor. Thank you, and I'll see you then.
Great. You have a great day.
You too.
Sure. Hello, Miss T. How are you doing today?
Oh, good, doctor. Yeah, I'm doing okay. My emotional relationship are very problematic though.
I see. Which problems do you have in your emotional relationships?
I can't manage to carry on with my relationship, doctor. It's tough.
I see. Can you give me an example of a relationship you could not carry on with?
My relationship with John, for example, it started well, then suddenly he started answering my calls hours late, which he never used to do.
Okay. So John's answering your calls late. In which way is it bothering you?
Doctor, he does not call me because he does not want to be with me. I don't know why.
What are your evidences for John's answering you late? Is showing that he does not want to be with you.
At the beginning of our relationship, he either answered immediately or called me back in a short period of time. But it's kind of different right now.
Okay. Do you have another evidence? Because I'm taking a note of what you're saying. I'm writing these things down.
Oh.
Okay?
Yeah.
To make sure we gather the facts.
Right.
Okay?
Right.
Do you have any other evidence, with the exception that he's returning your calls back late?
He did not answer other calls when he was with me when we initially started our relationship, but now at those people's position right now. He does